All right, ladies and gentlemen, as you all know, this is the Controversial Room. You already know me, I'm Prince Ewuze. Today we'll be discussing a wonderful topic, a topic that has cleansed so many lives. And I'll be doing that with Dr. Victor. He's already in the building with me here. So, Dr. Victor, please kindly greet the audience.
Hello, it feels good to be back.
Feels good to have you again. So how have you been?
Much.
Like how is life and the rest?
We thank God we are pushing.
Thank God.
And we are doing our part in terms of preaching the gospel in the health sector.
Okay, yeah, yeah. I can see. I do follow your social media, so I am seeing your wonderful work. So,
yeah, thank you so much.
So that's amazing.
So
moving on, before we continue what we have for today, you have to hit the notification bell and subscribe to the channel for you to receive a lot of updates coming your way from our YouTube channel. So moving on, like I said before, we have a wonderful topic today. A topic that has claimed so many lives. We want to discuss on cancer. So that is why we have our doctor today, Dr. Victor. Can you please enlighten the viewers about cancer? Many people don't know what causes cancer, how you can detect cancer, and symptoms of cancer, everything concerning cancer. I would love us to discuss it today. Right. What's your take on that?
Okay, thank you so much for this wonderful topic. Why I love this podcast is due to the kind of topic you normally select. They are really intriguing because cancer as a topic is a topic most people do not care about.
Yes.
Most people feel that Nigerians do not have cancer because sometimes or most times when you see the word cancer, you see it in all these movies, Hollywood. You understand? So in Nigeria, an average Nigerian might think cancer is not something we should be bothered of. It's not something we should even inquire of. But thank God for this wonderful initiative.
And people, sometimes people have this misconception or this narrative of cancer is mainly for Westerners.
Yes.
They are the one, so always suffering from cancer, not knowing that we are also at risk. We black. They will be like, black man doesn't have any business with cancer.
Yes, and if you check most of the deaths in Nigeria, some person will be like, one of my brother died. Do not ask the person, what happened to your brother or what happened to your friend? You say nothing, nothing happened though. The person just slept and did not wake up. It might be related to cancer. Yes, it can relate to cancer, long-term cancer, but it will be like
someone you just sleep and not waking up. It can be related
like a long-term. Cancer is not something that is acute. It's a long-term health condition. There are some conditions that someone will be into. Like we've seen some cases whereby you will not hear of someone before you know it. You see the person has died. You might have heard. That's the angle I'm coming from. You've not heard from this person for a very long time. This person might be undergoing treatment because it's a gradual process. It does not just occur suddenly like that.
Similar case of this Nollywood.
So it's a progression. You might see someone battling with cancer for 2 years, 3 years before you know, you hear that the person has died, and you be like, maybe you saw this person some time ago to ring a bell to you. So now begs the question: what is cancer? What we normally do in this podcast is to try as much as possible to break down concepts.
To a layman understand.
So anyone who just happen to come to this video, happen to see this video now, will understand what we are discussing. So what is actually the meaning of cancer? In simple definition, cancer is a condition whereby the cells of the body, they divide uncontrollably.
They divide
in the sense that cells in our body, they are guided on the way they are expected to grow. So when there's this abnormal cell growth, when the cell is growing the way it's not supposed to grow, it will lead to what? To cancer. All our cells, they have a rate at which they are expected to grow. So as the cell is growing, the cell is dividing. That is how we as human beings, we are growing as well. From being a child now to an adult. You see our body developing. Our organs, as they are developing, it means the cells are growing. But it will get to a particular point where these cells are no longer controlled because this division are controlled. They have there are some cell-like police. Let me use that word. There's some cells in our body that are like police. They kind of guide the way those cells will grow. Sometimes those policemen are no longer there, or they are not doing their job the way they are supposed to do it. So the cells will now begin to divide. There's an abnormal growth Understand? And it will not lead to the formation of maybe what they call lump, swelling. It can easily migrate to distant part of the body, or it can migrate to other cells, other organs, other tissues. That is where it is now even more chronic and more advanced. But cancer is not a death sentence. That's one of the things I want to let our audience to know.
So
it's not a death sentence.
Calm down.
Yes, you want anybody to hear the word I've been diagnosed with cancer. The next thing is that this person is going to die. No, it's not a death sentence. That is why we want to make this awareness. We want to bring this awareness that if detected on time, if you detect it on time, you can easily treat it and even cure the cancer. So
it's curable.
It's curable
if detected
on time. So if you can detect it on time, you can treat it, and at the same time, it can be cured. So that is why we always advise that Nigerians or anybody listening to this or watching this particular video, you should take note of the warning signs. Those signs you will see that will tell you that this thing might be pointing towards cancer. Because one of the problem of late diagnosis is that the signs are there, the symptoms are there. But most people will feel, it does not matter. It's just what I will take paracetamol or Panadol and the headache will just go. I'm having fever, okay, or there is weight loss. The person will be like, okay, there is weight loss, nothing is happening. I can just maybe by tomorrow it will go. You understand? Okay. That is the problem. So as you are probably thinking that it's not something of much importance. Time is of essence. And most of these cancer, the way they progress, some of them can progress very fast, some can progress very slow. You understand? So what are the signs now when you as an individual, you see these signs, you know that this might be pointing towards cancer. Number one is swelling or lump. If you check any part of your body and you observe any swelling or lump, it might be in the breast, it might be anywhere, any place you can easily observe.
Is it for women or for both?
Both men and women. Though breast cancer is more prevalent in women, that does not mean it cannot occur
to men.
In men. So you should check if there's any swelling in any part of your body, your legs, your hands, your faces. You understand? The breast. Take note of it and report to the hospital. You understand? But most of us, when we see any of this swelling, we think is a normal stuff. Some people might even bring rub. Yes. But if you say there are some kind of swelling you will see today, you see tomorrow, it does not even look like the normal type.
Or does it come and go? The swelling
does it
appear and also?
No, it's there. You see it. It's not like the one like boy you will see now. Maybe after 2 to 3 days it might subside. It's there and it's growing. Maybe yesterday it was the size of a peanut. Next tomorrow it might be the size of an orange. I don't know if you understand.
Yeah.
So that's the progression. It continues to go. Remember, we said it's an uncontrolled growth, excessive growth of itself. Yeah. You understand? So you need to pay attention to your body. So any swelling, any lump, even for the ladies, some ladies they tell them because cancer is a very wide topic.
Yeah.
Maybe some other time we'll discuss about the specific types of what cancer.
Okay.
They tell some ladies early morning when you're in the bedroom, you should check for the presence of lump in their breast. They teach them in the secondary school. You understand? So early morning, if you're a lady, you need to inspect your breast to know if there's any presence of lump. So if there's any presence of lump, abnormal swelling you've not seen before, you report to the hospital. So the same applies to anyone. You check your body. So swelling is one of the sign anybody should take note of.
Okay.
You understand? And the second sign is when someone has this, they call it unexplained weight loss.
Unexplained
weight loss. Like there's a kind of weight loss someone will have that you usually suspect that this thing cannot be ordinary. So even in the hospital, that's the number one question normally asked. Maybe the kind of clothes you normally wear before, it fits you, but now the clothes is no longer fitting that particular person. So weight loss is another indication, another sign that this person might be having cancer. So when someone has reduced in weight over time, the kind of weight loss you see in someone, be like, this thing is not ordinary. You need to go. It might be pointing towards cancer. So mentioned swelling. The second one now is now what?
Weight loss.
Weight loss. Unexplained weight loss. Now the third one is that you see there are some people that will come with wounds. The wounds will be dead. The wound does not heal.
I might target sugar.
Yeah, there are some diabetic a patient that has, they call it leg ulcer. That one is there. It might not be cancerous. You understand? It might not be cancerous. Maybe the person has diabetes, but that is why it is necessary. When you see a wound that does not heal, you have a wound.
Check yourself.
Yeah, you need to go to the hospital so that they will, if someone is a diabetic patient and the doctor, after looking at the wound and they see maybe this wound is not healing, there are some certain tests they will do to check if it's cancerous or not. So that's why you need to go to the hospital. Sometimes they can do a biopsy to know if this thing is cancerous or not, or if it's diabetic foot ulcer. You understand? So when you have a wound and the wound is not healing, please, it might be pointing towards cancer. Okay. Now, the fourth one is bleeding.
Bleeding.
Yes. There are some people that they observe, mostly in females, and they bleed unnecessarily, or we can call it uncontrolled bleeding from the cervix. You see blood coming out from the vagina. They call it cervical cancer.
That's not even normal monthly cycle.
Yeah. It might be due to maybe any kind of bruises that just occurred there. Even after sex, maybe might be a couple after having sexual intercourse, the person will bleed. You understand? Any kind of contact at that particular region will lead to bleeding. You understand? So mostly in women, when any woman observe like bleeding that's not supposed to be there, this is not your monthly flow. This is not when you're supposed to see this bleeding. You start seeing blood coming out from your private parts. You should report to the hospital. So those kind of things can be an indication for it. You understand? And another sign you can look for is when you see the person coughing, persistent cough. The cough is always there. It can be.
Severe? Is it always severe?
Yeah, for a cough to be persistent, like someone having cough for more than 1 year, 7 months, it should point to something that this can be. When a cough exceeds 3 months, it's not something you should take lightly.
I'm allergic to cold, stuff like that.
That one is a different thing. If maybe someone is
people that easily develop cold, or I don't know.
That is a different thing on its own. Someone can be asthmatic. You have asthmatic patients. That is different. They've diagnosed you that you're asthmatic. But this one, the cough is a severe cough. The person might be coughing blood. You understand? When you see those kind of cough that has stayed for more than 3 months, 2 months, it's a red flag. The one thing we don't understand is that our body always gives us signal. That's the way.
The funny part of it, we do always ignore it.
The body is like a machine. When a machine begins to
break down,
it gives signs. It gives the driver sign. It gives the operator sign that something is wrong. You understand? Same thing applies to our body. Our body gives us signs. So it's not left for you to take note of those signs, which we are discussing now. So if you see someone that is having swelling, you see someone that is having uncontrolled bleeding, unexplained weight loss, is a sign that it might be pointing towards cancer. You understand? So another one is another sign that someone can check and say, okay, this might be pointing towards cancer is when, number one, if someone looks at his bowel habits, if the person's bowel habits and bladder habit has changed. What do I mean by bowel habits? Maybe this person is having severe diarrhea. He's always passing out watery stool all the time, and the stool is maybe bloody. You understand? The person is having severe constipation. Constipation is always there. The food does not go down when you eat. It does not digest. You seem as if it's still in the stomach. You understand? Or it's still in the small intestine. The person should report. And another one is maybe if the bladder is not working the way it should work. The bladder helps us to store our urine, and when it's time to pass it out, you pass it out. There are some people, they find it difficult to pass out urine.
Yeah,
you understand? It occurs mainly in men. I don't know if you heard about prostate cancer. It even starts with a benign prostate. You understand? BPH, and benign prostate hyperplasia. That's a big word that we are not interested in. So if the person cannot urinate properly, or the person urinates more than it should be, frequent urination. The person always urinates, or the person after urinating, you seem as if the urine is staying inside the bladder. You understand? Or if the person the person cannot hold the urine, Before the person gets to the bathroom or to the restroom, he has already urinated on his body or our body. These are signs of that cancer is. It might not be cancer, but when you see these signs, it might be any other thing. Go and report to the hospital,
which is
because early detection will save life.
And funny enough, most people do feel, will I say, they feel shy reporting to the hospital. Or just like you mentioned earlier, you said a woman, or every morning a woman should examine
the breast.
Her breast. Some people will even look at it, this is weird. You get, and not knowing it's for your own good.
Yes, if you mostly if you're a lady, take note of this. You understand? Examine your breast every morning. It's very, very important. Examine your breast to check for the presence of lump. There are a lot of breast cancer now, even cervical cancer we talked about. So these are the signs you will see, and when you see these signs, you report straight to the hospital. When you detect these on time, it can be salvaged, it can be treated, and it can be cured.
Okay, Dr. Victor, thank you so much for explaining different types of cancer. So now, moving on, looking at days of our forefathers and now, you will find out that like a lot of cancer issues are all over the world, especially even here in Nigeria. You will experience that we have had a lot of cancer, people suffering with cancer or people living with cancer. Do you think, what is the cause of it? Because looking back then, our forefather, you see someone aging about 90, 100. Even my grandmama is 106. I can never forget that one. 106. Okay. So you find out. So what do you think is something we consume these days or something else?
Thank you so much for that wonderful question. This will now take us to what they call the risk factors of cancer. What can expose an individual to having cancer? What can cause cancer? And because of this question I asked, I'm going to start as my number one risk factor for cancer. And that is number one, unhealthy diet.
Unhealthy diet?
Yes. Now, when I say unhealthy diet, just as what you said, he asks, is it because of the kind of food we eat?
Now.
That answers the question. It's actually due to the kind of food we eat. Nowadays, we no longer eat natural foods. All our foods are now processed. You understand? So if you are an individual that you always eat or take in processed food, you are at a high risk of getting cancer. You are vulnerable to cancer, because this processed food, they contain preservatives, and these preservatives are chemicals. It's not that if you take one of those processed foods today and take the next one, maybe next 6 months, you have cancer. But we say continuous use. There are some people that don't eat natural food nowadays. You see them, everything they eat, they buy it from.
Maybe noodles.
Yeah, noodles. They take noodles. You see some people, they eat noodles Monday, Tuesday, Wednesday, Thursday. Month, they eat noodles. You are at high risk of getting cancer.
Really?
Yes, because you'll be consuming those chemicals. And those chemicals, they are carcinogenic. They can cause cancers. So under this same unhealthy diet, there are some people that eat red meat. Red meat can cause cancer. This is from WHO record. It can cause cancer. Red meat. And when I say red meat, some people ask, what do you mean by red meat? Red meat, number one, the one we popularly know, like the cow meat, that cattle, like goat meat. Goat meat.
I've forgotten that.
Goat meat.
Pork.
Okay. Pork meat. These are red meat that when you see it, when they cut the meat and you see it, they are red.
Even pork meat?
Yeah, even pork meat, they are red meat. Sheep. The meat of sheep, they are also red meat. So that's the unhealthy diet. Because this
goat meat,
even goat meat is part of red meat. Now this meat, and when you fry them, when you roast them like the one they call grill, it can lead to the production of some chemicals or carcinogenic substances that can cause cancer. Or this red meat. So if you're a kind of person that takes in this processed red meat, like those people that normally buy shawarma all the time, and in shawarma there's something they call hot dog. I don't know.
Yeah, hot dog.
They are gotten from red meat. Most of all those things.
Hot dog.
Yes, most of them are getting from red meat. Even this, they call it sausage. They are gotten from that red meat, and those processed red meat, they can cause cancer. So when you are this kind of person that always take in red meat all the time, you eat sausages all the time, you eat hot dogs all the time, you are at a vulnerable risk of having that cancer. You are so vulnerable. But when you take all these things, you don't take them too much, maybe occasionally, you are not at any high risk.
You know why I'm afraid? If you go to various houses, various homes now, you find out that they cannot deal without red meat.
That's why we advise people now.
Most homes do consume that every week.
It's not good. Instead, go for white meat. White meat example is chicken, turkey, fish. Go for white meat and live a healthy life. Right. Those red meat you see, they are not that good. If you are that kind of person that consumes it every time. So if you recall, in the past, most of them, they don't eat all this processed food. You understand? They don't eat all this processed food. Even if they are eating maybe the red meat that time, they don't eat sausages, they don't eat hot dogs. You understand? Because if you classify red meats that are unprocessed and red meats that are processed, the red meat that are processed have a higher chance of giving someone cancer than the red meats that are unprocessed. But nowadays, you even get meat in containers. There's some people, they get their red meat in containers. You understand? Yes, where they preserve and all those things. We no longer go for natural food. So that's one of the reasons. And another one, we've talked about the unhealthy diet. Another risk factor, again, is smoking. Smoking. Anybody, all these long-term smokers, anybody that smokes every time, every day, that person is also at a risk of having cancer. Lung cancer. Cancer can occur in the lung carcinoma. So some people will be like,
smoking.
Yes, smoke, cigarettes, tobacco.
Shisha.
Definitely. That person will have cancer.
I heard shisha almost even have high rate of.
Yes. Because of but these people, they are ignorant. That's why they are taking it. Those things contain carcinogenic substances. You understand? It's not good. So if you are this kind of person that engages in taking whether it's shisha or tobacco, cigarette, please desist from it. You might not get the effect now, but in the long run, you start having it. Even when you even stopped, you'll be like, well, I've stopped taking cigarettes. But this cancer, I told you, is a progression. It does not just come suddenly. It starts small, it's progressing, it's getting worse. That's why if you can detect it on time, you can treat it and cure it. But if you are this kind of person that does not go for checkups, how will you know that you have this or that? You understand? So that is smoking. If you are this kind of person that engages in smoking, smoke all the time, please desist from it now.
What of drinking?
Yes, alcohol consumption, excessive alcohol consumption.
What of soft drink?
Yes, that is when that is the processed food we talked about. Processed sugar can also cause cancer. If you take processed sugar, because some of these soft drinks, they have sugar there, processed sugar. So most of this processed sugar, they can cause cancer.
Some people cannot deal with that. Like before they eat, they must have maybe Fanta beside them or 5 Alive.
So please, this is for me. I say no one is saying you should not take those things. But if you can even stop taking soft drink, I would advise you to stop it. Drink water all the time. Water is very, very essential. If you can be taking water after your meals, it's even better than soft drink because they contain processed chemicals, preservatives that are carcinogenic to our body. And another one again is sun. Do you know the sun can cause cancer?
Sun.
Yes. Ultraviolet ray. Yes. Yes. It can cause it can cause cancer of the skin. Yes, it can cause cancer of the skin. That is why I do.
But like as their chances, does it have a very high chance of getting you causing cancer?
Yes, if you're always on the sun, under the sun all the time.
Pity for traders.
So if you're always under the sun all the time and you are not putting protective like clothes that will prevent that sun rays, it can cause cancer. So there are all this melanoma that they talked about. So sun, don't look at the ultraviolet light and say it can cause cancer. Even men looking at the sun, men looking at maybe you are this kind of person that is not, you don't put on glasses with the kind of sun we have these days.
Yeah.
I do recommend people to take protective in their eyes as well. You understand? There are some glasses that are not even medicated that will help you to prevent sun rays from entering your eyes. Because sun entering your eyes can cause a disease called pterygium. If you are this kind of person that you're always outside in the sun without glasses, you can have pterygium. It's a risk factor. So ultraviolet rays, frequent exposure. It's not that if you stay in the sun for one day that you are going to get cancer. That's not what we are saying. All these things are excessive. When you are always doing it all the time, it can cause cancer. You understand? So that's one of the risk factors. Another one again is obesity. You know what obesity means now? So obesity, if someone that is very, very, very fat, you understand, the BMI is greater than 30. So if anybody that is excessively fat, it can lead to cancer. You understand? So that's why we encourage people to always go for exercise. If you're obese, you go to the hospitals, they will give you a treatment plan, a nutrition plan. You understand? So obesity can cause cancer. So another one again is those people with frequent exposure to X-rays can give anybody, can give someone cancer. If you're always exposed to rays, you understand, 247, or you work in a place where you're always exposed to all these what they call it, chemicals, rays. There are some people that work in companies that deal with lead, mercury, all these big metals. They're exposed, arsenic and all those things. They are carcinogenic. So if you're maybe an engineer and you work in those kind of places without protectives, you understand, you don't have any protective materials that will prevent those chemicals from touching you. Because these things, they can ionize the DNA, they can change the DNA content of someone. So, and also people living close to those companies or those places they used to extract these metals are also at high risk of having cancer. Another one again is family history of cancer.
Okay.
There are some
So
people, it can be inherited. You understand? There are some families you go that you see the lineage, like it's always there. You understand? Family history. That's why it's very good to know your family history. So you know that in our family, this kind of cancer occurs.
You know the things to avoid.
Yeah. So and you know how to go for testing, to go for screening all the time. There are some family that have a gene they call BRCA1 and BRCA2 gene. So most of the people that have this gene, they are vulnerable to having breast cancer. You understand? So genetic factor plays another role as much as environmental factors. So there are also lots of risk factors that can expose one to having cancer, but the ones we just made mention of are most of the basic ones we need to take note of. And when we take note of it, we will know how to avoid them. And another important one is infection. Infection can cause cancer.
Untreated infection, maybe lung.
I want to be very specific in the type of infection that can cause cancer.
Be specific.
It's not that any infection can cause cancer. Now, there is a virus they call HPV, human papilloma virus. Remember, we said something about bleeding.
About it last time.
That we said something about bleeding.
Yes.
We also said in our previous
video.
Now, mostly it occurs in females. The HPV virus, that human papilloma virus, is the virus that causes the cervical cancer. You understand? So, and that HPV can be gotten sexually. It is a sexual transmitted. It can be gotten from sexual intercourse.
Wow.
You understand? That is why females, they are advised to vaccinate themselves for HPV. You understand? When they are from 9 years to 14 years.
From 9 to 14.
Yes, but
above that you cannot.
You can't too, but if maybe you take the vaccine, might not be of any importance to you.
Really?
Because we talk about progression. We talk about progression. It takes time for the one thing about vaccine is that when you take a vaccine is like you are taking the disease itself, so that it will make your body to build its immune system, so that when the real disease come, it will be there. And it takes time for the body to adapt. You understand? The body will be releasing some of those immune cells as time goes by. So that is why. And secondly, from that 9 to 14 years, that is when most of these ladies engage in sexual intercourse. Yes. You understand? So you have to prepare them. Yes, you have to prepare them and prepare the body. You understand? So, but from that 26 years, sometimes it might not be of essence to the female in particular. You understand? So, but if people from 25 to 26, they can still take the vaccine, but it will be under the recommendation of a doctor. You go and see a doctor and they will guide you on how to take the vaccine. So if you are listening to this particular video, please, if you have a male or a female from the age of 9 to 14 years, take them and go and get HPV vaccine. I think it's even free for children. 9 to 14, it's only adult that the vaccine is kind of expensive. So please protect yourself. You understand? Protect yourself, because you don't know what is going to happen. Most times in males, the vaccine, the disease is asymptomatic in males. It's mostly in females that the thing
Okay.
occur. And most time male are the one that even transfer it to female. So that's why it's very important. So infection is another cause of
Okay.
cancer, HPV. Another infection again is hepatitis. You might have heard of hepatitis
Yes,
B,
I've heard of
hepatitis A, hepatitis C.
C.
Now, among these hepatitis B and hepatitis C can cause
Cancer.
liver cancer, to be very, very specific. Mostly the hepatitis B, very, very deadly. So, if you've not taken vaccine, if you've not vaccinated yourself, please do well to vaccinate yourself. Go and take hepatitis B vaccine. You understand? Go and take hepatitis B vaccine. So, hepatitis B can also be gotten through sexual intercourse as well. Can be gotten through blood exchange. Understand?
So someone said even you touching, even your body clashing with someone, you can
body fluids.
Yes.
Can get it through body fluid, and that is why most times some people don't even take. Like me specifically, this is just for me. It doesn't. It is just my own resolution. I don't take drinks. I don't take drinks like all this soya milk. Soya milk that are homemade and they will put in a container that was not maybe refined. You understand? I don't take it. Or those because I do
Zobo.
see, yes, and Zobo. I do see some of them. They go outside to look for the container.
Yeah.
And this container, maybe someone else might have a seat. They will go and wash it with soap. It's not that it even undergoes sterilization. They didn't even go through the sterilization process. They will just use Omo and maybe small water and wash it, and they will sell it again for another person. Me, that's my. I don't take those kind of drink because someone's fluid might be there. Someone that took the drink, the fluid from the saliva might be there. The virus might be there,
and it doesn't die of all.
It doesn't die like that now because
it takes time.
What is that? If maybe the fluid, if the fluid is there, and it finds its way to the human body, it can replicate again.
Really?
Yes, it can replicate again.
Even when the fluid is not maybe active or maybe.
That's one thing about virus. Virus need a living cell to survive, and they replicate. You get, sometimes it might be the time frame is even short. The thing is that you don't know the way they process this stuff. They might not even wash it, or immediately they might just take it. Immediately they might just take it and do it again. So those are drinks that normally don't go through the normal sterilization process. I don't really advise people to go for it, except you know the person producing it. I know that this person they maintain 100% hygiene. Then you are good to go for it. You understand? So these are the ways some people do get all this hepatitis B unknowingly. And they will be like, how? I did not have any sexual intercourse with anyone. There was no place where there was an exchange of blood or fluid. How? This can be a route to it.
And speaking of this hepatitis B, I think it's already taking like, according to statistics, I heard that it's even more deadlier than HIV.
It's more deadly than HIV. But what people don't know, it's very, very deadly because it can cause cancer of the liver. It can lead to liver failure, then chronic liver disease, then cirrhosis, then cancer. You understand? But HIV, if someone is under retroviral drug, it can. But you see HIV patients still normal, looking fresh and the rest. But you don't want to joke with hepatitis B. You understand? So they have vaccines for. I think they have vaccines for hepatitis A and B. For C, I don't think the vaccine is yet out, except in some places like China. So the moral lesson here is that if you've not yet been vaccinated, go and take the vaccine. But first, before you go and take the vaccine, they will tell you to do the HPV test. You will do tests to know if you have the infection or if you have protection against it. Because there are some people, mostly those people that they gave birth to newly, and that is not, they didn't give birth to maybe 90, 80 and the rest. Because now in our NPI schedule, there's some hepatitis B vaccine they do give to children. Children, yes. When they give children, they give them. When they go for this immunization, they give them this vaccine. So they will check if your own is still active. If not still active, most health workers too, they are advised to take the vaccine because they're always involved in.
So speaking of taking the vaccine, when you take the vaccine, does it have a lapse period? Does it elapse for you to take another one?
It has doses. Okay. You can take the first dose. So those doses, they give it in dose, and it's a kind of a long time vaccine. Most people don't need to take again when you take it. Most of these vaccines, they are kind of long time to serve you till whenever, because the immune system has been revived to fight against that particular disease. You understand? So that's why vaccination is good. You need to vaccinate. If there's any disease that calls for vaccination, everybody should vaccinate themselves, because when you vaccinate yourself, you are protecting from getting the virus.
So is the vaccine free?
It's not free, you pay for it. You pay for it. But if you happen to have any of all this outreach, if you maybe happen to listen that there's any outreach that are giving free vaccine, you can go for it. You understand? So this is.
So you can get the vaccine at any hospital at all.
Yes, even primary health center, you can make your inquiries and get the vaccine from there and get vaccinated.
After meeting a doctor, you cannot just go and get the vaccine and start.
Yeah. Even if you go there, they will ask you, have you done the test?
Yeah.
The people giving it will ask you. That's the protocol. You test yourself, you screen yourself to know if you have it or not before you proceed. Now we've looked at the
hepatitis B.
That's the infection. So infection can cause. Now there's another thing we need to understand. How do you prevent this cancer?
Exactly.
Since we've looked at the signs, we looked at the risk factor. How do you
especially breast cancer and also the one you mentioned,
cervical cancer.
That one is also among this prostate cancer.
Okay, prostate cancer. How do we prevent all this cancer? Is when you look at the causes, that's the risk factors. From the risk factors, you can easily know how to prevent it. The first one we talked about, unhealthy diet. So what comes to your mind is eat well.
Yeah.
Healthy diet can prevent you from having cancer. Eat good food that are rich in fibers, that are rich in vegetables. It's not all the time meat. There are some people say meat even cause problem in their family. You will tell that you must buy that cow meat. So you must buy that cow meat. We need meat every day. My sister, you're putting your family in danger. Or my brother, if a man always if there's no meat in the soup, while I don't bust, I will not eat this food. Instead, go for white meat like chicken, turkey, fish. Eat more fish. If you see omega-3 fatty acids.
No, I'm not a lover of fish.
Yeah, it happens. Some people don't eat fish, but you enjoy eating chicken now.
Yeah, chicken.
So chicken, turkey, there's always an alternative. You understand? So it's not that we are saying you should not eat red meat, but
at least once in a while.
Yeah. Don't take, since you know that this is a risk factor. Be wise. You understand? On average, know how you take it. You get. So that's the first one. Another one is exercise regularly. Because if you're this kind of person that always do your normal physical activity, you exercise on a daily basis, you will not be obese.
Yeah.
Most of the people who are obese are those that live sedentary lifestyle. They don't go out, they don't work out, they don't do any form of exercise. So if you want to prevent yourself from being obese, engage in exercises. But people will be like, I used to work, but there are some things you do, you think you're doing exercise, but that's not exercise. So engage in exercise. Now, if you are this kind of person that smokes, stop smoking, quit smoking. You see the way we are taking the prevention, quit smoking. If you always consume alcohol, quit, reduce your alcohol intake. Because all this can cause some liver disease, alcoholic liver disease, that can even lead to liver cancer. If you stay in the sun 247, protect yourself. Always put on your face cap and some protective materials. Because there are some people, they walk under the sun 247. That's their work. So you have to be very, very careful.
You know these people where they hug.
Yeah. So you have to be very, very careful. And another one here again is that if you know you have a family history of cancer, always go for medical checkup all the time to know if maybe you have one or not. Because when you detect it on time, you can easily treat it. And this cancer can occur to anybody, whether it's a young or old. Cancer is not only meant for elderly people. It can also occur to children. You have children cancers like leukemia and the rest, cancer of the blood.
You didn't talk about that. That's leukemia cancer.
Yeah,
what causes that?
It's still the same uncontrolled cell division in blood cells. You understand? It can cause leukemia, cancer of the blood. You understand? So that one is there as well. There's also the one they call retinoblastoma, cancer of the eye. See the person's eye will swell. It occurs in children as well. All these children cancer. So cancer can occur both in the adult, can occur both in children. But same thing we discuss. Pains, there are some pains someone will observe now and say, this pain is not a normal pain, it's still there. It can be a cancer. Now, there's something I want to clarify. Some of the misconception in cancer.
About it.
Number one is that cancer cannot be transferred. Just like maybe I sit close to you now, I'll get cancer. No, it cannot be transferred that way. You understand? So you should not stigmatize anybody. Or you see someone that has cancer, you shouldn't stigmatize. Because most time this cancer, some people that has cancer, like breast cancer, most of the breast cancer we see, you see some ulceration on the breast, like a sore, even smelling. Instead, they need our support. You need to sympathize with them. You shouldn't stigmatize anybody. It can happen to anyone. So cancer cannot be transferred from one person to another by just staying close to that person. Another one again is that someone cannot use witchcraft to give you cancer. Just like what some people say, that they used to match poison. Maybe we'll talk about that another time.
so you want to tell me there's nothing like
there's nothing like that.
Matching poison there.
What the person has is either they call it lymphedema. It can be due to infection. It can be due to obstruction. It's what they call elephantiasis and the rest filariasis. Nothing like that. We need to explain this thing. We need to explain it to people so they understand. They will say, don't take that person to the doctor. Don't go to the hospital. If you go to the hospital, we've seen cases like that. We've cured many cases of lymphedema. They're in the hospital, they're receiving treatment. Some have even gone home well, healthy.
But there are some people, when they take them to hospital, they will be like,
not true.
Doctor said nothing. Like nothing. Everything is okay with
It's not true. It's not true. We have doctors who are specialists in that area. If you go to a teaching hospital where you are specialists, or even if you don't go to a teaching hospital, they refer you. We have specialists. We'll see many of these cases. That's what I'm telling you. If I've not seen now, I'll tell you I've not seen. I've seen cases. I've even handled cases of lymphedema. Even the patient uses his mouth to say he matched poison. But when we took the history.
So what of all this one where they talk achere?
That's what we are saying. There's nothing like that.
So there is nothing like that
in the medical field. There's nothing like that. And we've treated cases of it. Remember, once detected on time, they can be salvaged. Most of all those cases that that they took to the hospital, they could not do it. It might be that it has entered the advanced stage. Because when cancer, all those things, there are some lymphedema that are cancerous. Like there are some, this cancer, it can occur in the breast and it will spread to the bones, to the spine. The person cannot walk. There are some people that has cancer, they cannot walk. You go to the bones, the spine, the vertebrae, and damage it. You understand? So it spreads. It does not stay in one place. It's spreading everywhere, to the stomach, everything. You understand? So, but what if you detect it on time? It can spread to that lymphatic system and block, those things are lymphatic drainage, and block the lymphatic drainage. And when the lymph is not being drained, it will gather there and cause swelling of the leg, which some people call like they've matched poison. You understand? So this
you will not blame me. I have that misconception.
If you notice anything like that,
some people don't even travel to their village because of that.
No, there's nothing like that in the medical field.
And there is this one. They always recommend native doctors for that. They call it Agba belt, whereby something like rashes will start growing from your waist. They said once it's joined together, the person will die.
All these are superstitious. That's why we say all these are myths. When you see all these signs that we made mention of, go to the hospital straight, and a doctor will take your history and know what is wrong with you, know the possible treatment. Why we are saying this, why we are creating this awareness is that most of the cases we receive in the hospital are always late cases. We want to start receiving early cases that will attend to it on time and treat them on time. Remember, any problem you treat from the root, you solve it like you resolve it finally, like you resolve the whole issue. But when the problem has not escalated, you see, to get to the root, you have to pass many hurdles. You have to cross many bridges to get to the root. Same applies to illnesses. When we get this illness on time, we can actually treat it. You understand? So these are the prevention. The prevention can be gotten from the risk factors we make mention of. If you eat processed food too much, please cut it down. I know of some person that will say, I cannot do without it. You're endangering your life, my brother. You're endangering your life, my sister. Some people will be like, we can take anything. What do you now want us to take? I've made mention of it. Eat beans, eat vegetables, fibers, grains. These are healthy food. Eat more of it. Eat mostly vegetables. They contain antioxidants that can help to kill all those cancerous chemicals or carcinogenic.
Some people cannot deal without shawarma.
So if this is for our ladies, I always love shawarma because most of the people that love shawarma are ladies. If you're this type of person that eats shawarma all the time, 247, you're always on shawarma.
Even
suya, those things are going from red meat. Cut down on it so that you live a healthy life. All these are carcinogenic substances that can cause cancer. No one is saying you should not eat your shawarma. Don't come and say you should not eat your shawarma, but cut down on it. But if it can allow you not to eat shawarma, you can even Stop. Your life is more important, but everything has limits, and you should maintain that limit. You shouldn't eat anything you have excessively. All these things can lead to cancer.
So are there other factors we need to know about cancer?
These are just the basic ones, the basic signs, the basic symptoms that you see, and you proceed very fast to the hospital. Like the prostate cancer that you mainly found in men, like prostate, like men, you should go for checkup. I've been saying men, go for checkup, check your PSA level, go to the hospital, check if maybe having problem with urinating. This prostate cancer.
But what can cause? I know you made mention of a lot of things.
Yes.
But that in particular, you still want to tell me what we
that prostate. It has a family history too. Most times, if your father has prostate issues, you are also liable to have prostate problem. It comes with age, actually. Most people, once they get to 45, 50 years, they find it difficult to urinate. Some even urinate frequently, and they think it's a normal stuff. It's not normal. Please go for checkup. It's one of the issues. I think there's a World Prostate Day coming up in the month of June. Yes, and it's a topic we really need to talk on, and because most men don't even know about prostate.
Yeah,
most people don't know about prostate. But if you go to the clinic, go to the urology section in clinic, you see a lot of men coming down with prostate. And prostate is a very, very expensive disease that you don't want to joke with.
Can it be cured?
It can be cured. That's when we say if detected on time. But most people, they detect it
very late.
Maybe when they are 60 years or 70 years, but it might be progressing from 45, 50, 51. So please, if you've not gone for prostate examination so that they examine your prostate, do now. If you're up to 40 years, you understand, 40, 45 years. Even if you are 30, if you can go and check, it doesn't matter. You understand, your health is what matters. Go for regular medical checkup. You understand?
So there are some people that said having frequent intercourse can
prevent
prostate.
It's not true. It's not true. It's not true. Because I've not seen any maybe, but I don't think it's true. I've not seen any articles on that. Except maybe there's a new publication on that.
Yeah.
Because if that is so, there are many people that don't engage in sexual intercourse and they are still healthy.
Yeah.
Like some of the Reverend Father that said they don't marry, and some of them don't come down with it. So it's more than that. It's more than that.
So before we round it up for the day, your final thoughts.
Yes. So what I have for our audience out there is that cancer is never a death sentence. When you hear the word cancer, it's never a death sentence. Even if you are diagnosed with cancer, I've seen testimonies, I've seen cases of patients who were diagnosed with cancer. Today, they are bouncing, they are kicking. If you even see them, you see them as if nothing happened to them. Why? They accepted that they had this issue and they went for treatment. Treatment started on time, not late treatment. When they met with their doctor and the doctor gave them advice on what to do, they followed the advice. Though most times when it is diagnosed late, it can take a whole lot from the family. Like financial aspect, like it can ruin a family's finance. You see someone that is even wealthy coming out to beg. That's one of the thing you don't want to even joke with in terms of cancer when it has progressed to the advanced stage. That's why we are creating this awareness. If we detect this on time, we can easily serve it. You will not spend much. I've seen wealthy families that have gone down because of cancer, and even at the end of the day, they even lost the person without to be going for chemotherapy, surgeries, and the rest. So, but
funny enough, some people do survive.
Yes, they survive. They survive at the end of the day. They survive.
But it's on a rare basis,
Yeah, on a rare basis, but people do survive. Mostly when you detect this on time. That's why we're using early detection. It's never a death sentence. When detected on time, it can be treated and it can be cured. The question you should ask yourself now is, when last did you go for medical checkup? When last did you go for medical checkup? When last did you even stay in the bedroom to observe your body? Early morning you wake up, you as a man, you as a woman. When last did you stay in the bedroom and examine your body? Check your face on the mirror. Check your skin. Check your scrotum as a man. Check your penis as well as a man. Inspect it. There's nothing to be shy there. You as a woman, check your vagina, check your breast. Examine it very well to see if it's normal and if it's abnormal. Don't be like those people that when they wake up, the first thing they do, they go and attend to their job, they attend to their money. That job you're attending to, that work you're attending to, when cancer comes, you will not even think of it
just
again.
clear everything.
You will not even think of it again. So make your health a priority and share this video to your friends, and then make sure they watch
Very,
it,
very
so they will be enlightened. Information, knowledge
very
is power.
important. Subscribe to the channel.
Yeah.
So there are a lot of topics. And again, I want to remind us, we will still have Dr. Victor in the building this coming week.
Yeah.
We will be discussing on fibroid.
Yeah.
A very interesting topic that you will not love to miss out.
Very, very important.
So this is more reason you should subscribe to this channel. Also share the video, share the link. You might be saving someone.
Yeah.
You get? You might even be saving your future wife and husband.
Very, very important.
So that is it. So I'm your humble host, Prince Ewuzie, and Doctor, it's very nice to have you once again.
Thank you so much.
We'll be expecting you another
I can't wait for that next edition.
Yeah.
I can't wait.
So bye guys. So we'll see you on our next video.
Bye. Stay healthy.